Hello and welcome to the CAPE training program. My name is John Leatherman. CAPE is short for Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. This training and related activities was sponsored by the Substance Abuse and Mental Health Services Administration, the U.S. Department of Agriculture, and the USDA network of regional rural development centers. The objectives of the program are to enhance behavioral health literacy by offering the mental health first aid workshop with an emphasis on substance abuse. Our second objective is to motivate the creation of community coalitions to address local behavioral health needs, such as those related to the opioid epidemic. Finally, we are encouraging the notion of formal action planning to create a community roadmap for improving the local situation. In this video, we'll talk about successful communities and identifying community assets that can be mobilized to respond to a problem. Over the years, I've worked in many communities. I've also driven many miles going to and from those communities. That has given me time to reflect on why some communities seem able to get things done, while other communities that may appear similar seem to struggle. While we could point to many different reasons, I have come to conclude that there is a characteristic that is very important. It's something that communities large and small can do, and it doesn't cost anything. That something is building networks for the purpose of collaboration. The building blocks of networks are effective community leadership and active community organizations coming together. I've noted that where the density of these community networks is greatest, those communities seem better able to get things done. Where you have collaboration occurring, capacity is multiplied. If I work with someone and we help each other, what we can do together is greater than what either of us can do alone. Here are some of the characteristics I think are important. Effective leaders can think about community issues very broadly. They can see the breadth of an issue. They understand its complexity and appreciate the interconnectedness of the systems that contribute to the state of community affairs. Effective leaders can communicate their thoughts and ideas effectively. Effective leaders tend to be open and non-defensive. They are not turf conscious. Then you need to have a large number of active and effective community organizations and institutions. These are both formal institutions like local government, schools, law enforcement, and the faith community. They also include informal and voluntary organizations like chambers of commerce and civic organizations. Ideally, each of these entities are reasonably effective in achieving their primary purpose or goal. When these entities come together, they form networks. These networks do not need to be formal. They can be ad hoc and exist for as long as it makes sense. They can be as small as 2 entities or as large as may be needed. Places that seem to have a greater density of these networks have more people coming together. There is a greater amount of communication and sharing of information and ideas. There tends to be a greater level of community understanding and agreement about goals. They are positioned to be able to help each other. Where this is occurring, those communities tend to be the most vibrant. More good things seem to be happening. There is a greater ability to get things done. This is exactly the premise behind the notion of creating coalitions to mobilize around community mental health and substance abuse problems. The whole process of bringing the community together and getting it from here to there starts with a clear idea of what needs to happen. Reflect back on the CAPE Community Action Planning template I introduced earlier. We're going to talk about how to complete all elements of creating an effective plan and ultimately motivating community action. It starts by clearly articulating the scope of an issue. It might be a very narrow need or a very broad goal. We need to identify what needs to happen in order to achieve the goal. In the community context, we typically want to influence the level of awareness, increase knowledge, influence behavior, or create new policies or programs in relation to something. Once we've articulated what we want to happen, we need to specify the community we want to change. The relevant and effective community to take action might be your city block, a neighborhood, the entire city or county, or even some multi-county region. All might be considered a community for various purposes and needs. Then we have to identify the relevant stakeholders to the issue. In the case of community behavioral health, we can identify multiple levels of stakeholders. Directly, it might be the community mental health agency, public health department, hospital, shelters, and other agencies. Indirectly, it would involve law enforcement, folks at the county jail, and city and county officials. In a third tier, but also important, would be the local business community, educational institutions, the faith community, civic groups, the local media, and other major institutional entities as may exist. In my home county of Riley County, Kansas, we have a couple of networks for the purposes of behavioral health and social service issues. The Riley County Mental Health Task Force brings all of these entities together on a regular basis. As I mentioned earlier, they have made some impressive progress in dealing with mental health issues in our community and our region. We also have something called the Riley County Council of Social Service Agencies. What I note about this group is that they have a very fluid agenda depending on what members are doing. They have no great expectations of solving problems. They come together to talk and share information, to discuss community needs and share ideas. They are poised to collaborate when it makes sense for them. Once stakeholders have been identified, it's a good idea to do some background research. You want to know what they see as their mission and what they are currently doing. This can mostly be done with some internet searching. Most of the stakeholders will have a website and will tell you what their mission is, what their priorities are, and what they do. Having this background information will give you a notion about how to approach them, how to frame issues to their interests, and how to avoid stepping on their toes. Once again, most of what you need to know is available on the internet. It won't tell you about people or personalities, but it's a starting point as you approach them. Once you know what exists, a useful exercise is to ask yourself what is not there that may be needed. In the context of dealing with substance abuse, you may find that some entities or services that you think may be very helpful do not currently exist. For example, it might be a short-term crisis center as an alternative to taking a person to the hospital emergency room or the county jail. This may help identify potential priorities for some sort of collaborative action. Having identified the stakeholders to a potential collaborative network, you gather information about the needs that exist and the work that has come before. I'll point back to our discussion of gathering available data and conducting primary research, packaging it in an accessible and digestible form. Then you want to learn something about the history of what has been done before. You don't want to suggest reinventing the wheel. You want to be ready when someone says, "We tried that 10 years ago and it didn't work." You want to be able to say that you know about earlier efforts, but this is why you think it will work now. So with that, we'll wrap up for right now. In our next video, we'll continue our discussion of assessing community preparedness by talking about assessing local leadership needs. We'll also talk a bit about community public relations and the use of social media. Here's how to get in touch with me. Thank you for watching.